As the date for the launch of the Social Health Insurance Fund inches closer, the new public health insurance plan is still facing resistance from a section of Kenyans as chiefs began their training in Kisii County. Now, Kenyans disrupted an online training session for SHIF rollout as more university lecturers marched in the streets of Eldoret to protest the implementation. Well, here's Sheila Chelangat with more.
With just hours to the set rollout of the new social health insurance plan, SHIF, the government seems to pull all stops to achieve the seemingly insurmountable task of ensuring some 12 million households are registered.
County commissioners.
Days after the sensitization meeting that brought together officials from the health and interior ministries, trainings for chiefs have begun in earnest in various parts of the country.
Tumepata mafunzo mazuri. Why SHA and not SHIF?
The plan is, however, not without its share of uncertainty. This online training session, exclusively meant for health workers, for instance, was interrupted after several unauthorized Kenyans accessed the login details, expressing their discontent over the scheduled rollout plans. A preparation update meeting that was to state the level of preparedness for the rollout in Nairobi also failed to happen, leaving more questions than answers. In Uasin Gishu County, KMPDU and Kenya National Union of Nurses, More University chapter, took to the streets opposing the SHIF rollout.
NHIF brought overseas treatment. People went to India over NHIF. The program you've brought of SHIF, it is basically a planned corruption.
We cannot imagine having peanuts for dental services and eye services. What are we going to use for our eyes?
Clauses challenged include the limited postnatal care. Under SHIF, mothers are restricted to only 2 free postnatal visits compared to the 6 months of coverage previously available.
Mumweka antenatal care service as an abbreviation of ANC, it's just a joke.
Of concern too is the provision for emergency care services that have been suspended due to resource limitation, raising concern about access to timely medical assistance in emergencies. It is these gaps in coverage that have prompted Kenyans to call on the government to hold to the rollout plans and relook into the implementation structure of the fund. Sheila Chelangat for TV 47.